We want to say a very special thanks to the self sponsors who are ensuring that you women are treated with the level of grace that you truly deserve. Gillette Venus razors provide a smooth and moist, rich shave over every glide. Its soft grip handle ensures no slip control. There's no Venus product. There is rather a Venus product for every woman, whether you're looking for a system that requires cartridges, which give you more usage per razor, or the convenience of a disposable razor for that one time use. Here's a great tip. If you shave once per week, it's estimated you will change your razor every 4 to 6 weeks. Venus razors are great for use on legs, underarms, and the bikini areas. Venus, reveal the goddess in you. Distributed by Caramid Limited. So just keep that information in mind as we go to Body Talk. Certainly not about shaving, but about heart attack. And inside Body Talk, we have Dr. Mark Hosang. Or is it Husang? I
It's Hosang actually.
Hosang. All right. I got it first right the first time.
Yep.
Good day, Doc. How are you doing?
Hi there, Mr. Smith. I'm good, thanks. Thanks for having me on your show.
Yeah, man, my pleasure. All right, so today we are going to be looking on heart attacks, and that is something that many persons have at least known someone who perhaps have suffered as a result of a heart attack. And we want to hear more on it, and I'm sure that you'll help us to get that objective fulfilled. Now, what are heart attacks?
Well, a heart attack is essentially where there is a blockage inside one of the blood vessels of the heart, what are known as the coronary arteries. And because of the blockage, it prevents blood from flowing to where it's supposed to go, which is the heart muscle. The blockage is usually due to a clot, which may occur right there in the vessel, or it might have traveled from somewhere else in the body. And because of the blockage of blood flow, the heart tissue no longer receives any oxygen or nutrients. So that area of the heart will die eventually if that vessel is not opened up soon enough. So a heart attack really is where you have a sudden blockage of a blood vessel leading to death of your heart tissue.
All right. Now, death of the heart tissue. I've never really heard that. So please expand on that. Why is the heart tissue itself so important?
Right. So the heart is essentially a muscular pump. So it's a muscular bag, and every time it goes through a cycle, the muscle contracts. And with each contraction, it squeezes out the blood so that it goes to the rest of the body and to the lungs, right? So, like any organ, the heart requires oxygen and it requires nutrients. So if it is deprived of oxygen for any prolonged period of time, that heart muscle actually, that area that's supplied by the vessel, it will die. There are multiple vessels involving the heart. There are three major ones. So it depends, the amount of damage that's done to your heart is dependent on where that blockage may occur. These
Okay.
blockages usually occur because of cholesterol buildup inside the blood vessels, these coronary arteries. So over time, cholesterol builds up in these blood vessels, causing it to get narrow and restricting flow, which limits the amount of blood and oxygen and nutrients that can go to the heart tissue. But what happens with a heart attack, however, is something very sudden, where this cholesterol, what we call cholesterol plaque, it will rupture. So it actually cracks. And there are different reasons why it cracks, but these episodes where they crack tend to be very unexpected, which is why heart attacks can occur at almost any time and not necessarily related to you doing any specific type of activity. You could be just sitting down having dinner, and that plaque can crack. And once it cracks, it causes a clot to form right there in that blood vessel, and that clot prevents any further blood flow, and hence the muscle dies if that clot is not removed or doesn't dissolve on its own in due time. So because your tissues can only survive without oxygen for a certain amount of time. If you imagine, if somebody were to be strangled, for example, the
Yeah.
analogy is somebody being strangled, you cut off their oxygen, and then they would survive for a certain amount of time. But if you were to hold on that pressure and to restrict airflow or blood going throughout the body, then that person would eventually die. So it's a similar principle.
It's a similar principle. Okay, all right, I understand perfectly. All right, so are there different types of heart attacks, or all heart attacks are heart attacks, for whatever reason?
So I guess yeah. So yes, there are different types of heart attacks, but most heart attacks, well, almost all heart attacks are bad, and every now and then I'll come across a patient who will say, "Oh, I just had a small heart attack and I'm okay now." So,
Okay, that's
which kind of
optimistic.
it is sometimes a little bit too optimistic for my taste, because
Yeah.
then it kind of takes them away from actually understanding the seriousness of the problem.
Okay.
Because there's a saying, as serious as a heart attack, and that's true.
Mm-hmm.
So I mean, there are different types of heart attacks, but for the most part, for the patients, it's going to be very similar. They would normally present with things such as chest pain, which is the typical symptom that we think of, which is traditionally a more of a crushing or a pressing type of chest pain, usually in the central area, but it can be almost anywhere in the chest. And occasionally it can go down into the arms. So it might radiate up into the shoulder and down into the arms. And it often keeps company. And the company that it keeps is shortness of breath. So shortness of breath usually comes along with it.
Mm,
Excessive sweating can also be a feature. Racing of the heart or palpitations, as well as fainting, may also be a part and parcel of that package. In terms of the different types, though, back to your original question, we need something called an ECG, which is a special type of heart test that will help us to determine the different types or what type it is based on the changes that we see on that ECG. And
okay.
based on the type of heart attack will determine what the immediate plan of management would be.
Okay. All right. Now, who are the at risk or the most at risk group to contract a heart attack?
Okay. So there are a number of risk factors for people who are at risk of having a heart attack. Age is probably the number one factor, which is not something that many of us can do anything about until we find the fountain of youth. Um, but the other things that we
Okay.
call that we, all right, the other things that we consider are what we call the modifiable risk factors. So these are things that we all hear being talked about: hypertension or high blood pressure or pressure, as people know, diabetes or sugar, high cholesterol, which is basically a type of fat in the blood that predisposes to clogging of the blood vessels. Smoking is also a significant risk factor, and obesity is also a significant risk. So,
Mm,
so those are the predominant things.
okay. All right. So you mentioned some of the symptoms, such as shortness of breath and fainting and all, and that type. Now, so are you mentioned earlier that some persons say that they've just had a mild or small heart attack. Now, obviously, all heart attacks aren't fatal, or especially in the immediate sense.
Correct.
But how dangerous is even the slightest of heart attacks?
Well, even the
Um,
slightest, yeah. So even the slightest heart attack can be dangerous depending on where it is and what some of the downstream or spin-off effects or complications of the heart attack are. Because so one, the heart attack damages the heart muscle, so the overall heart function gets less. So the heart actually becomes weaker because the muscle is damaged. The other complications include things such as very rapid heartbeats, what we call arrhythmias, which is probably the number one cause of death early in anybody who presents with a heart attack. So, because of the heart damage, it causes almost like an abnormal electric circuit or a short circuit in the heart, that can lead to a very rapid heart rhythm, which actually the heart goes so fast it actually doesn't fill properly. So it's not actually pumping out any blood over a period of time because of how fast it's pumping. And once your heart is not pumping out any blood, you die, which is the most common reason why people die suddenly in relation to heart attacks. There are other things there. You can have actually rupture of the heart muscle, where a wall of the heart muscle can, because of the death, it causes a weakness in that spot in the heart, causing it to rupture, where the blood leaks outside of the heart or into a different chamber of the heart where it shouldn't be going. And this also can result in a very fast death. So it depends a lot on where it is, because even a small heart attack can result in an arrhythmia or that irregular rapid heart rhythm, which can cause sudden death. So,
all right,
it's a serious thing.
Indeed, I cannot imagine. Now, if someone suspects that a relative or a friend is having a heart attack, what can they do? Or can they do anything with at the immediate onset of the symptoms or the signs of heart attack to perhaps lengthen or heighten the chance of survival?
Sure. Well, the first thing is to give them aspirin. So a regular dose aspirin, which is like the 325 milligram strength, so which is different from the low dose or from the baby aspirin, where you give them aspirin to chew. So it's not to swallow, but it's to chew immediately. And then if you think that they're having a heart attack, seeking urgent medical attention with the hope of opening up a blood vessel is probably one of the highest priorities. So give them aspirin to chew and immediately to the nearest emergency room, hospital.
Okay.
So not the doctor's office, but the hospital. So if you think you're having a heart attack, don't go to the doctor's office, go straight to the emergency room. I've had a few, I think I'm having a heart attack. Can I come and see you in your office? And my answer to that is no, you cannot see me in my office, because I don't want you to come and die in my waiting room, because one, that's bad for business, and it's also bad for you. Going to the hospital, nearest hospital, is your best chance of survival if that's what's happening. My waiting room is not the place for that.
Okay.
Yeah.
All right. Now, so are lifestyle changes perhaps the best route in terms of mitigating against contracting a heart attack? Is there any genetic disposition to heart attacks as
definitely,
well?
Definitely. So lifestyle changes, definitely. Almost all the chronic non-communicable diseases such as diabetes, hypertension, and high cholesterol, those all can be affected by lifestyle changes. Is there a genetic link? For sure. I mean, if you have a first-degree relative, meaning like a brother, father, sister, mother, who has had a heart attack, especially at an early age, which in men less than 55 or women less than 65, if you've had a first-degree relative who has had a heart attack at that age, it means that you're clearly at risk. And those patients will need to be followed up a lot earlier, and to look at all the risk factors that can be modified, like hypertension, diabetes, high cholesterol, and definitely they shouldn't take up smoking if at all possible.
All right. What are the treatment options, as we wrap up? What are treatment options that are involved if someone has had a heart attack?
So if they've had a heart attack, apart from the aspirin, there are other medications that can be given, which are usually best given inside hospital. Other agents that might help to thin the blood, so certain blood thinners can be given, one of which is called heparin. There are other drugs called beta blockers, which help to slow down the heart and reduce the heart's demand. If you reach the hospital in a good time or early, there's a possibility that a test or a procedure called an angiogram can be done, which is where we take pictures of the blood vessels of the heart by putting a tube in the large vessels and carrying it around, and then injecting a dye for us to determine where the blockage is. And then once we have determined where the blockage is, we can open up that blockage using a balloon called an angioplasty balloon. So a small balloon that we put in the vessel to kind of blow it up over the narrowing, and then put in what's called a stent, which is like a little wire slinky that we'll also use over a balloon to inflate that in the walls of the blood vessel to help to keep that vessel open. So that would be the main thing, and which is why reaching the hospital early is important. If you're reaching the hospital after 12 hours of the onset of your chest pain, then it limits the amount of treatment that you can receive, because a certain amount of damage would already have been done, and we might be limited in what type of medications can be used in order to open it up, because there are also what we call clot busting drugs that can be used to open up the blood vessel if you can come in within 12 hours. So there's a little window that you have to try and get through to achieve the best care. Within 4 hours would be best.
Okay, okay. Very good to know. Very good to know. All right. How can persons connect with you personally if they think that they've suffered from a heart attack and they'd love further consultation? How can they reach out to you? But before you answer that, Diane Smelly is asking, how can
Yes.
one differentiate between a heart attack and an asthma attack?
That's actually a very good question, Dan, and I'm glad you asked that, because many people who have heart attacks are actually diagnosed with having asthma, because asthma can also present with a tightness in the chest. It can also cause you to be short of breath, and you can wheeze, which is a typical symptom of asthma. But if you have a heart attack and the heart starts to fail, that can also cause you to wheeze. So it can be quite complicated to tell the difference between the two. Knowing the history of the person involved helps, because if they're known to have asthma, and this is the classic pattern at the classic time, then that might be a useful indicator as to what it might be, as well as response to the usual asthma treatment. Like, for if they're not responding, then we'd have to consider something else is wrong, and then going straight to the hospital for the doctors to help to differentiate between the two would be the best option.
All right. All right. Sounds good. Thank you so much for the information. Again, where can we connect with you? How
Oh,
can we?
yes, right.
Yeah.
I work at both a university hospital as well as in private practice. To see me, well, it wouldn't really necessarily be me, but in order to see a cardiologist at the hospital, which would be one of them, would be to get a referral from your general practitioner to our cardiology clinic there. Outside of that, in private practice, I work at the Winchester Business Center, which is at the corner of Winchester Avenue and Hope Road. It's a 3-story building. I'm Unit 33, Suite 33 at the Winchester Business Center. And the phone number for the office is 906-5666. 906-5666. We're open Monday to Friday. You can just give us a call. One of the lovely ladies who man the front desk would be more than happy to take your call and make an appointment for you.
All right. All right. Thank you so much, Dr. Hosang. Thank you for joining us, and thank you for the information, and all the very best.
You're welcome. Thank you very much for having me. I appreciate it.
Excited about the vaccines?
Oh, very much so.
Okay. All right.
I'm hoping it comes in quick, because one of my other duties is that I occasionally have to work with the COVID patients in my non-cardiology capacity at the hospital. So having some amount of protection would be nice.
Okay.
So I'm hoping that comes in pretty soon, as well as the fact that the beds are really full right now because of the outbreak. So even our heart patients are suffering, because just people trying to get a bed just to be seen for non-COVID related illnesses is a real problem. And I mean, the Jamaican public have to do a little bit better. Social distancing, wearing of masks, hand sanitization. And remember that 90% of these patients who are COVID positive may be asymptomatic. And one of them could be a best friend. So when you're all hanging out on Lyman, please keep that in mind. Not saying you can't hang out online with your friends, but let's just be careful and maintain some amount of protocols while we're doing that. All right. So please, Jamaica, let's be safe, because the doctors alone can't do it. We need every single person to be on board on this health thing. COVID is no joke. It's real. The vaccine is also going to be of benefit. So if you do get a chance to take a vaccine, no matter what it is, no matter which one it is, it's definitely better than not having any vaccine. So we're all in this together. It's one big forest fire, and it's going to take everybody to put it out. It's not just a one-man show.
Again, this perhaps is beyond your scope. I'm not sure if you'd be at liberty to speak, but would a private scheme to get the vaccine be of any benefit to Jamaica, so that persons don't have to wait in the government lineup, so to speak? Do you think that would help?
Well, I'd be very careful with commissioning private. So there's usually a role for private-public partnership. So that's one. So the general principle, the answer would be yes. But we'd have to be very cautious about that because in recent news, there even with some of the testing, there seems to be some discrepancy between who is doing what and who's selling the kits.
Mm,
So I'm not sure the details on it, so don't quote me on that. But
yeah, okay.
from my understanding, there's a little bit of a confusion along that line. So we have to be very careful, and it would have to be under the close watch of the Ministry of Health and certain guidelines because we don't want the 20-year-old perfectly healthy person to get a vaccine before somebody who has like heart disease, right? You just had a heart attack, you're high risk. So there are certain people who should get priority. So I think that understanding that there is a priority and a vaccination scheme in terms of the different groups of our society who are immunized or vaccinated first or in order. I think that's very important. So, and when you have to be very careful because once you're not under one central control, then it leads to certain bending of ethical principles, right?
Perhaps. Yeah, yeah.
Yes.
Okay. I'm happy I have a doctor to share, because I asked it as a, what do you call it? As a capitalist, right? I
Yeah.
asked a
Yes.
capitalist,
Okay.
an individual who just wanted to know, can this work to get productivity back? Could that be a possibility? Who can pay
I
for it, and
Yeah.
who can't wait on the government system?
No, well, definitely. I'm all for that. I'm somewhat of a capitalist too. Uh, but so yes. So I mean, I think that if it's not interfering with what the government's plan
Yeah,
is,
yeah.
then sure. I mean, if we're not going to deprive people who really really need it, then sure. If we're going to cut those people out the line, then
I have a problem with that.
I would have a problem with
Yeah,
that.
yeah, yeah, yeah. Definitely.
But definitely for those people who can. But even that's kind of tricky because there's a global shortage of vaccines right now, and there's a lot of vaccine nationalism, where a lot of the developed countries are really stepping it up. I mean, just last week, Europe had declined to export certain vaccines to countries outside of the Union, Australia being one of them, because they said they didn't have enough. But so you
And
know,
yet in Europe, many states, will finish vaccination, full vaccination by summer, and you don't have enough.
right.
Yeah, a
Yeah,
lot of
yeah,
education.
exactly. That's the
Education.
whole point, and that's the whole point of vaccine
Yeah,
nationalism. But it's short-sighted because it's a global problem, and to think that you can only sort it out by doing things within your borders is a very short-sighted way of looking at things, in my opinion. I mean, I'm
yeah,
not.
yeah.
I'm just a cardiologist, right? So just talking off the top of my head. So you can take that with a grain of salt or whatever you want. But I mean, it's a global problem, and only by treating people on a global level can we really come to an end to this, and can we really see the light at the end of the tunnel. Otherwise, we're going to be in this probably for another 2 years. I mean, and it's not a nice place to be.
Certainly, certainly. All right, thank you so much, Dr. Sang. Thank you for joining us, and all the very best. Hopefully, it comes today, and hopefully by should it be Wednesday, you're fully inoculated.
Well. I mean, it's 2 doses, so
Okay.
yeah. So it's 2 doses that are supposed to be separated 50. Sorry, 2 weeks apart. We're supposed to be getting 50,000 doses. I'm not sure if we're just going to vaccinate 50,000 people and then hope for the second dose to come later on down, which is an approach that the UK has taken, where they've given a lot of people the first dose, and have actually delayed getting second
The second dose.
dose,
Okay.
because it does provide a significant amount of immunity, even just the first shot,
First
even though
shot.
it's not the full dosing. So some immunity is better than no immunity. 50% immunity was said to be generated by the first shot of most of the vaccines. So AstraZeneca, which is what we're likely to get, Pfizer, Moderna, which are the others, and Johnson & Johnson is the only one that's really one shot. So, which is currently being approved, or is approved. It's all a moving target. So, forgive me if I'm a little bit behind.
Yeah.
But Johnson & Johnson vaccine is probably the only one that I know of right now close to being put into effect. That's a one dose shot. So we'll see. I mean, I
Canada,
look to my
Canada has approved that one. Yeah.
yeah. Well, don't get me started on Canada.
All right.
That's a whole other
All
conversation.
right. That's another.
Because they've done such a poor job for being a first world country, and they don't actually produce any vaccines there. So as big as Canada is, as many resources as they have, they're actually not producing vaccines within their own borders. The closest place to producing is a factory in Montreal, which was supposed to have come on board around now, but it hasn't, to the best of my knowledge. And there are other things from what I've been reading that are also questionable ethical principles amongst their politicians as to why this was so, because there were other groups that might have been ready to carry the ball, but they were not given the funding. As there were other companies giving funding for questionable reasons. But
Yeah.
I'm just a cardiologist.
Yeah. You're just a cardiologist. Yeah. A highly informed one. Thank you. Thank you again, Dr. Marcus Knight. We have to wrap up here. All the nervous and take care.
Thank you very much, Mr. Smith. Great being
Yep.
here. Thanks a lot. Have a great day.